All right, what's up, guys? So episode 4-4 here, long overdue. Section 4 is all about elbow, forearm, wrist, hand, that kind of stuff. Go back and watch the previous videos. We talked about the bony anatomy, we talked about the muscles, we talked a little bit about nerves, and today is about self-treatment and exercise if you're having any issues in this region. All right, so I'll show some clips alongside this of some pretty simple stuff that you can do. And in a way, they're exercises, they're stretches, but in a way it's diagnostic. It can kind of help you figure out where exactly your pain's coming from, okay? So super simple here first. We've got a stretch for the wrist flexors and we've got a stretch for the wrist extensors. Now, take a look, because we're not just, it's important to realize that we have multiple layers of muscles in here, and when we want to open up into wrist extension, meaning we're stretching the wrist flexors, we need to make sure we get these pronators also. And again, the pronators are gonna turn your forearm down, your palm down. So they're gonna limit what's called supination. So when we're doing a wrist flexor stretch, we always wanna add in a little bit of supination, and then the opposite is true if we're trying to get the wrist extensors. You wanna have some pronation. So you wanna make sure you get that rotation in there into supination when you're trying to stretch here, into pronation when you're trying to stretch the extensors. So this stretch can be helpful if you have a wrist or if you have elbow pain. Try 2 to 3 rounds, 20 to 30 second holds, and see how you feel. All right, so in this next clip, I've got a probably too heavy of a band for this, but you can use a strap like this, a belt, or a super band. But what we're trying to do with this is kind of reposition that elbow joint so that you can actually strengthen the muscles. A lot of times it just hurts to use wrist extensors, and this can be with gripping or extension. And that lateral force that I have, the band is right here, like just beyond my elbow. That lateral force can really reset the joint and take a lot of pain away. It's pretty miraculous. And like I said, you can work wrist extension, you can just work on gripping. If you're able to get the pain gone, then you can actually work on strength. Pain's very inhibitory to strengthening. Okay, in the next clip, we're putting some tape on. Now this is kind of along the same lines as the traction with the super band. What we're really trying to do with the tape is drag all this tissue out this way so that we can put a new line of pull instead of it being direct, kind of bend the muscle fibers and take some tension off that point of attachment on the outside of our elbow. And this is similar to if you've seen somebody wearing one of those thin kind of Velcro straps. Similar idea, but actually the tape is better because you can get that crank and guide that tissue. And actually it doesn't matter which way you go, whichever way helps you/the patient more, that's the correct way to go. I will say typically it's this direction, okay? And this is great because you can leave the tape on there for 2 or 3 days and work on some stuff that maybe you couldn't work on otherwise. All right, so in the last clip, these are called nerve glides. I'm showing 3 different ones. The first one here is gonna bias more towards the median nerve. Again, go back and watch some of these previous episodes so you can see where the median nerve is, but just real quick, that's the nerve that goes through the carpal tunnel. But imagine the nerve, because it does come out here, but just imagine a string that comes from your neck through the front of your shoulder, on down, through the front of your wrist, and into these 3 fingers. So we're putting a little bit of tension on that nerve, and it may, if this gives you some familiar symptoms, then that could kind of guide guide you to some appropriate exercises. This is not a prescription for anybody. If you've got questions about this stuff, please reach out to me or your go-to healthcare provider. This is just meant to improve knowledge, and if it's something simple, the stuff can actually go a long way. So in the second part of that clip there, when I tilt my head, that's adding more tension. So if you already feel it without your head moving, probably don't add that in. And definitely don't start with that. See how just the arm movement feels first. We call this one the tray dump. And it's just gonna tension glide that median nerve a little bit. The next one, a lot of different names for this. This is the ulnar nerve glide. So the ulnar nerve goes through that cubital tunnel on the inside of our elbow and then on down, pinky, ring finger. So reasonable to feel symptoms, numbness, tingling along that path as you do this nerve tension or nerve glide. The last one is for the radial nerve. Seemingly affects the fewest number of people, but I think this one kind of hides under the surface a little bit, and we have different symptoms due to radial nerve dysfunction. It doesn't show up as the hallmark numbness, tingling, and that's a really deep rabbit hole to go down, so I'm going to leave it at that. But the radial nerve comes down and it's going to be more on the back of our hand. So if you've got any kind of symptoms back there versus the median's more on the palm side, radial nerves on the back. So if you're having any issues in that area, potentially some radial nerve component. Again, guys, don't see this as a prescription for you. If you're having issues, take this stuff with a grain of salt. It's meant to improve knowledge, but not be specific to any one person. As always, let me know if you have any questions. This was the 4th episode of section 4. So look forward to section 5 coming at you. Have a great day, guys.